Hey everybody, Ben Hallback here with Catto&Catto. Being that it is 2020, we are doing a lot of these recorded meetings. And so I'm going to be walking through the insurance and the benefits for this next year. So as I look over here, I'm going to be looking at the screen. And as I look right here, I'm just going to be pretending that we're in one of the conference rooms. And so here's the good news. All the insurance carriers stayed the exact same as they did last year. Here's the even gooder news. All the pricing stayed the same. So there's no difference in your paycheck from last year to this year. There was an increase from the insurance carrier, particularly Humana. Delta Granite absorbed that increase on behalf of all the employees and did not pass anything on. And so the company took all of that expense and left the net effect to every employee to be a no change. So that's super generous. I'm going to walk through these benefits real quickly. I know this year we're going to be breaking up in about 8-person meetings in some different conference rooms. So let's truck along. Medical, dental, vision, life are all the same benefits as they were last year. The bottom of this first page, y'all, those are qualifying life events defined by the IRS, are reasons you can go to Liz in the middle of the year and say, I want to change what I chose during open enrollment. Open enrollment starts on the 9th. It ends on the 13th this year. And so whatever you choose during open enrollment will stick for the next year unless you have one of these qualifying life events. Plan is the same as it was last year. Humana is still the carrier. The National POS Open Access Network is still the network. You've got copays when you go see a doctor, primary care, $40, specialist, $75. You've got copays when you go to get a prescription. Copay is just a flat amount when you use the service. So when you get a script, you're either going to pay $10, $40, or $70 most of the time. When you go to the doctor, you're going to pay either $40 or $75. Retail clinics are $40. Virtual visits, super convenient, especially right now, are $40. When you go into the hospital or get like imaging or something like that, that's when your deductible is going to kick in. You have the same deductible as you did last year, $2,500 every year. And then if something gets really, really bad, you've got that out-of-pocket maximum. Out-of-pocket max is $5,000 on an individual basis. That is for the calendar year, January through December of 2021. And that's worst case scenario. So when my mom was in the hospital for 70 days, about a year and a half ago, she hit her out-of-pocket max. So that's the threshold that you have to pay. And then insurance picks up everything else as long as it's covered and in network. All those benefits are the same as they were last year. Rates are the same as they were last year. So it's broken out by how many folks are on the plan, just like it was in the past. Also, don't forget, take advantage of gold, silver, or platinum discounts inside Go365 with Humana. We actually have Humana at Catto&Catto, and I participate in Go365. I wear this thing and it tracks when I walk around or jump around or whatever I do. And I get points from Humana for that. In fact, I just redeemed $50 from Humana through Go365. And you want to know what I bought? I bought 2 hats with Bigfoot on them. I'm really into Sasquatch hats right now. And Humana bought them for me, so I'm feeling pretty good about it. So make sure that you get synced up with Go365 and get engaged. It's super easy. We have 2 individuals, both of whom are named Michelle, inside of our office if you have any questions on Go365. And there's going to be a couple of slides in here that I'll hit in just a sec. Knowing where to go, we talk about this every year, so it's just a reminder. Freestanding emergency rooms are emergency rooms outside of a hospital. So you've got emergency rooms inside of a hospital, you've got emergency rooms outside of a hospital. Unless it's life or limb threatening, go to a retail health care, go to a doc in a box, go to urgent care, but those freestanding ERs are emergency rooms, life or limb threatening, and you go and get a big old bill. And most of the time, you're going to be waiting a long time if you go to an emergency room, freestanding or not, when it is not an emergency. Dental is the same as it was last year. Guardian's still the carrier. The price is the same. You've got 2 different plans. Here's where it gets confusing. So it's entirely dependent upon who touches your teeth. Okay, so I want you to take a look. Hopefully y'all can see that I'm highlighting this right here. if you plan to use a dentist that is inside of the Guardian network, the value plan is yours. There's more value to you staying inside of the network. If your dentist that you like and you don't want to switch is outside of the Guardian network, then you're going to the network access plan. Benefits are almost the exact same on both. There's just less of a likelihood of out-of-pocket costs for you by staying in the Guardian network. So we always want to stay in network no matter which insurance it is, but both plans work pretty much the same. You get $1,000 per mouth. So if you have 3 kids and 1 wife, you get 1,000 for you, 1,000 for the bride, 1,000 for each kid. Those teeth cleanings covered twice a year, those are freebies. They're covered by the cost of the plan, but if you have a cavity or something going on, then there will likely be a cost for that, and that will reduce your annual maximum of $1,000. So think about dental as like a bucket of money that Guardian is just throwing at your mouth every single year. Costs are down here. Those didn't change, so I think that's pretty good news. The DHMO plan is less expensive than either one of these plans. So you got the kind of the same plan, but depending on the network, you're going to go either value or network access plan. The costs are the same in terms of the premium that's coming out of your paycheck. And then you've got this DHMO, or Dental Health Maintenance Organization, DHMO plan. When it says fee schedule here, that means there's an alphabetized book of any procedure that you could get. These are more your Horizon Dental, Castle Dental, things like that. Dentists that you're not going to go to see the same person every single time. You do have some ortho covered in here as well. I like that. But you've got to choose a dentist when you enroll. So you can go to guardiananytime.com and make sure that you're choosing the right network. Managed Dental Guard. So this is the less expensive way. Honestly, I'd probably be on a plan like this because I don't need much dental insurance. I'm not real picky. I just need my teeth cleaned and x-rays done. So this plan would be pretty suitable for somebody like me. Vision, if this is blurry, you should get that checked. How about that? You're going to go in, you're going to pay them $10, and you'll get $135 for some cool guy or cool girl frames, and then you'll get 20% off after that. So you get an allowance that reduces the bill. So if it's a $150 pair of sunglasses, then insurance is giving you $135. You got $15 left. You get 20% off 15, which is $3. So that's how that works. You get more if you go to VisionWorks. It's a local outfitter there. Get some lenses on a $25 copay, but if you've got to shrink them down, if they're real thick, I just went to my eye doctor the other day and I got to shrink them down because they're so thick. You're not getting out for a $25 copay. That the difference in cost will be on you. Mine works the same way. Or you can get $135 for contact lenses. And so it's either or. That's what this benefit frequency towards the bottom of the page. You can't get glasses and contacts paid for by insurance at the same time. You pay for one and their allowance goes towards the other. Rates are the same. Those didn't change. Free life insurance, how about that? The only downer is you're no longer living to access this benefit. So it's 100% paid for by Delta, Granite, and Marble. Your beneficiary down here is where the football goes, so to speak. If you're no longer holding it, it's got to go somewhere. It can be anybody you want. And you can change your beneficiary if you want to. EAP, free to you, paid for by Delta, Granite. Go to humana.com/EAP, confidential counseling and referral services for anything that 2020 could throw at you. How about that? Premium only plan means we don't take tax out of this, which is a good thing because that means you don't pay tax on these benefits. Okay, helpful Humana flyers here, and then we'll be done. This is a nurse line, telemedicine support. This is kind of, that page kind of tracks the know where to go page that I commented on earlier. A listing of preventative services. So inside your medical plan, you got some free stuff. Preventative services are covered by the cost of the plan, covered at 100%, meaning free to use, $0. Here's all the different things that are covered for free. Not going to go over all those for the sake of time. Just want to make sure that you have this information because who doesn't like getting free stuff? This is how to register with Go365. You can also call our office or email one of the Michelles or email Jamie, your contact point here at Catto for anything customer service related, and we'll help you get synced up too. Humana.com, enter your member number or ID, create a username or password. That's for the Humana app. So there's two different apps. You got a Go365 app and you've got a Humana app. The Humana app, you can research in-network doctors, see where you are on your deductible and out-of-pocket maximum, stuff like that. The Go365 is just for wellness. So that's where you want to go in and see your points. So you can buy a Sasquatch hat or two. More information on how to register and use their app is right here. And you'll get to see, you know, all different kinds of things on there, including your ID card. Don't have to carry it in your wallet anymore. Just carry it on your phone. Your phone's with you anyway. This is super cool. Humana Pharmacy mobile app makes refills in a snap. That almost sounded like a rhyme. Check it out. Take a photo of your pill bottle, review it to make sure it's accurate, download the app. This I wasn't even aware that this was a thing. I'm not going to go start taking prescriptions just because it's so easy to get through the app, but I am saying it's pretty easy to get through the app. You take a look at that. Take a picture of the pill bottle, get it refilled. Download the free Humana Pharmacy mobile app today. Sound like a used car salesman, so I'm gonna move on. Then they send it to your door. That's what this slide says. Seriously, pretty cool, pretty easy. GoodRx. This would not be running a prescription through your insurance. It's a discount program. So a lot of times manufacturers just offer big fat coupons. And sometimes those coupons generate more savings by using the coupon than it is actually running it through your insurance. So if you're on a prescription, you want to download that Humana app, and then you want to check GoodRx, see if you can get a better deal from them. I do. All you do is you can scroll through it online. You can look at it on an app. It's pretty user friendly. Here's Go365. So the previous slides did the Humana, registering for the Humana app. This is for Go365. So there's an app. You can also register online. You'll go to go365.com or download the app, do it all from there. You'll start doing some of these things. Check it out. Earn points by completing healthy activities. So you'll get your Go365 age. So if you're 35, but your lifestyle, actually, you're treating yourself like an 80-year-old, then Humana is going to tell you that on the app. Spend your bucks in the Go365 mall. That's where I just bought some Sasquatch hats. Here's some points to be able to get to silver. Honestly, here's the simple approach. Get a step counter, Fitbit, something that will sync with Go365. Almost everything does. You can contact us for more specific questions on which devices sync and which don't, because there are a lot of them out there. But get a step counter. Your phone is also a step counter. And so just make sure it's synced up with Go365, and then you're going to start getting points just by walking around and moving. Depending on the level of points that you have, you either get blue, bronze, silver, gold, or platinum. The higher the metallic tier, the more points you get. This slide is a listing of all the different ways to get points. So it's divided into these different categories: education, fitness, prevention, healthy living. So there are all these different things that you can do to get points to get Sasquatch hats. Health assessments, fitness points, biometric screenings. This is that virtual visit, 24/7, 365. You're going to call this fella and he's going to talk to you. Yours, I think, is $40. We took a look at that on your first page, schedule of benefits. The name of the provider is called Doctor on Demand, so that's the app that you want to download. Concentra, those are urgent care clinics all over the place. So that's a good alternative for a freestanding emergency room. That EAP that's free. Here's some more information on what you get out of it and where to go. More info on the EAP and what it covers. Rest of this information is great late night reading material. So just close your eyes right now for the sake of me scrolling through all of this, because it can be kind of dizzying. Absolutely welcome to read all this stuff later. We're not going to go over these for the sake of time today, and we'll end on this page. Open enrollment starts the 9th, ends the 13th. Contact Liz. She'll have the forms. She'll get them back to us. We'll turn them in. Coverage takes effect December 1st, but remember, for deductible and out-of-pocket maximums, it always runs calendar years. So we're saying our yeses and nos before January 1st, because this policy goes into effect 12/1, December 1st. But since nothing's changing, I just want you to be aware your deductible always resets in January. Mine does too. So that's pretty typical. Contact Liz if you have any other questions. Contact Jamie in our office if you have any other questions. And this is a vendor lineup of 1-800 numbers, just in case you're bored over the holidays and want to call an insurance company. Sorry we cannot be with you this year. Always look forward to these meetings, and heck, right now I look forward to seeing anybody, because I'm seeing the inside of my house. Y'all did my countertop, so I'm looking at that a lot. We hope you guys stay safe, take care out there, and thanks for the long-term partnership, and hope you have a much better 2021 where you can go anywhere you want than 2020. Y'all take care. Bye-bye.